Welcome to the podcast. My name is Dr. Noor Gajraj. We are going to talk about functional medicine and also toxic mold syndrome. And I have an expert in this field, Dr. 셔녕ഥ. He has spent his medical career trying to answer the question, what is the best way to help my patients heal? After a decade of exploring, researching, and listening to his patients, Dr. Joe is proud to offer an effective blend of conventional and functional medicine to his patients in his private practice. So, Joe, thank you very much. I really appreciate you talking there. There aren't many people as well versed in these issues, so thank you very much. So, first of all, maybe you can tell us what is functional medicine and a little bit about your practice and what types of patients you see.
Yeah, thank you for having me, Noor. Truly a pleasure to be here. And functional medicine to me is an idea. It's not a single lab test or single treatment or the fact that you use lifestyle medicine. It's a question. Why is my patient sick? Right? What is causing the illness or the symptom in my patient? And then the next piece is, of course, and how do we fix that? But the beauty here is this is the question that's been missed in conventional medicine is just throw the pills at the patient.
Mhm.
And even from my perspective, you see the integrative doctors doing the same thing with just herbs and nutraceuticals and vitamins, right? It's not
Right.
a thought process of why is my patient sick? How do we do the basics and then move on through our thought process of what's making them ill? It's just
Mhm.
throwing things. So we have to ask why. Every patient will be
Mhm.
different. And to me, that's what it is. And it means you can be an MD and do this. You can be a dietitian. You can be a chiropractor. You can be all sorts of practitioners if you are using the toolkit that you are trained in and answering the question, why is my patient ill?
Good. And we were saying that you see a lot of cases that have been through other practitioners and they still haven't got a satisfactory result.
Yeah.
Why is that?
Well, I tend to see patients who've fallen through the cracks, right? They've been to many conventional specialists, they're still sick. And for those patients, it's typically the conventional doctor is clueless on lifestyle. They don't
Mm.
know how to help them achieve the lifestyle goals, and they don't have any other answers or training or interest other than prescribing a pill. And a lot of that is a system they practice in when they're paid by volume. They're not paid by getting their patient well, they're paid by treadmilling them through, and the quickest way to treadmill them through is to throw a pill, right? Those are the conventional
Yeah.
people. The integrative people who've been through the integrative world, a lot of times they've been sold this idea that if they just buy a couple $1,000s worth of lab work and then we micromanage the lab work with supplements and bomb them with supplements without thought, that they can get better. And
Mhm.
the body does not heal like that. It never works.
Mhm.
And so those patients have kind of also been sold kind of a bag of goods. And so from my practice, after doing this for a long time and listening carefully to each patient in front of me and having the opportunity to have a small private practice where I can research and think, I like to pull from the best of conventional medicine when it's the labs and the medications and the differential diagnosis, but also a heavy emphasis on lifestyle medicine, herbal
Right.
treatments when necessary, and all the other pieces that patients really need to heal because you need both, right?
Yeah, more of a an integrated approach. What I'm
Absolutely.
trying to promote is it's called a bio psycho social spiritual approach. So
I love that.
yeah, so you're targeting multiple areas, not just the biology or a supplement, but ask them about their exercise, ask them about their diet, simple things, stop smoking.
Yeah.
But yeah, so give us some examples of the patients you see and how your different approach has helped them get better.
Well, a classic example is someone with SIBO, that's small intestinal bacterial overgrowth. And this is extraordinarily common. I mean, IBS is rampant in the US population. Millions of patients have it. And probably 40 to 50%, depending on the study, of those patients have SIBO. So this is kind of an epidemic that's gone underdiagnosed. And the GI doctors now recognize it. When I first started, it was SIBO doesn't exist, right?
Mhm.
And now they've read their own medical literature and now they're fully on board with SIBO is real. We've got
Mhm.
ICD-10 codes, right?
Right.
And so what I do for these patients is they've usually come in and the GI doctor has given them the drug rifaximin. and they feel
Right.
better for a week, and then everything comes back. And the
Mhm.
reason is that the GI doctor didn't set a foundation to heal. He never had them do a periodic fast, never had them try a low processed food diet or a low FODMAP diet, never set the stage for gut healing with probiotics. So I have them come in and do that. And a large amount of the time, that's all they need. They didn't need the antibiotic. They needed the fix from the lifestyle, the reason why they got SIBO. And then if they still need more, right? Because not some people have these stubborn cases, really high gas levels, they need additional treatments on top. And that's where the herbs can come in or the antibiotics, right? So
Mhm.
you got to blend the lifestyle and why does this person have SIBO with the right tools? People get better.
Yeah. So you're talking about gut health,
Yeah.
and there's a lot of interest in that because, with your guts, it's got most of your immune system in it,
Hmm?
connection between the gut and the brain. So what is your approach to improving gut health?
I mentioned it before, and
Yeah.
I just taught a lecture at the Colorado Integrative Medical Conference, and I want to keep things as simple as possible for people because you have these protocols out there, these 5 Rs, and is it replace before remove, and is
Mhm.
reinoculate before recycle, and it gets confusing. So foundationally, I want people to fast. And I know, Dr. Noor, you are big on optimization, and there are very few tools as helpful for longevity as fasting, right? So fasting in my world is something that can immediately reset the gut for a lot of patients, but also promote longevity and healthy metabolism, right? So we're doing two things at once. Then I'm getting them on a diet. And we know that diet is doing, it's not just the fact that it's going to be less harmful to the gut when you're reducing the processed foods and the sugars and the low FODMAP, but you get better nutrient density, right? You get
Mhm.
all of the carryover effects of a good diet. And then it's the probiotics, right? Probiotics to me are the missing piece in so many of our cases. When you look at the evidence, this is the super drug. This should be the billion-dollar treatment because we have meta-analyses on probiotics. Not just does it remove abdominal pain and constipation and bloating and diarrhea in GI cases, but it can treat osteopenia, right? It can lower blood pressure, can lower blood sugar. The A1C goes down. It improves cognition in Alzheimer's patients. It makes the flu vaccine work better. On and on and on. You have
Mhm.
meta-analysis showing probiotics help. But most often, doctors don't know to give a broad amount of probiotics, and sometimes they're a little gun shy and not giving a proper dose for their patients. So that to
Mhm.
me is just a fundamental, you know, do not break glass, do not pass go. Do you have the lifestyle and do you have fasting diet probiotics on board? That's the basis for me.
Do you like probiotics better than prebiotics, or do you use both? Because there's pre, and postbiotics, isn't there? Do
Yes,
you see
sir.
any
I,
distinguishing
yeah,
features?
I see a lot of patients with quite reactive guts and pretty advanced IBS. And if I give them prebiotics heavily, those fibers are often fermented in the gut and they get symptoms. They get more bloating and heartburn and GI irritation. So I stay away from that and I tend to just push the probiotics.
Okay,
Uh,
probiotics.
yeah, and I haven't found butyrate to be very helpful in my patient population. So for me, it's really probiotics.
Okay.
Keep it simple.
And how long do you get them to fast for?
Well, fasting,
Yeah.
we could spend an hour here. I love this.
Yeah.
It's more mental than physical, right? And so most of the game is convincing someone they can do it. And
Right.
so I usually have them start with a 24-hour fast. I say go from dinner to dinner, right? So you have dinner, you go to bed, you're fasting, you skip breakfast, you drink a bunch of coffee, you skip lunch, you drink tea, maybe some sparkling water or bone broth, and then you have dinner. And they get hungry at like 2 o'clock.
Yeah.
I'm like, look,
Yeah.
4 hours. You can be hungry for 4 hours. And then they get 24 hours. And my GI patients is pretty cool, right?
Yeah.
Because they typically get to that 18 to 20 hour mark and they're like, holy crap, I'm not bloated. My belly doesn't hurt. And then
Hmm.
they see, oh, okay, there's obviously an issue here. I need to let my gut heal. And then they're incentivized to repeat this weekly as a
Okay.
reset. Or
Once a
a
week.
couple months down the line, they may find that they've flared up. They're eating more hot dogs and beers, right?
Hmm.
And they flare back and they say, oh, Dr. Joe just told me I could fast, and they can do a fast and just get things settled. I do other things, but that's the core way I like to use
Yeah.
it.
So let's circle back to processed food.
Yeah.
I always say that America's got the worst food in the world. Would that Would you think that's right? Because
I
of the
have,
processing.
yeah, no,
Um,
no
they
question.
s- there's one saying that if you buy something and it's wrapped in plastic and it has one ingredient that's not in your kitchen, it's highly processed. So, I
I
mean,
love that.
we're looking at 90% plus, and I haven't done it yet, but I want to just not eat any processed food for a month. I mean, and people have done that say they just feel great. It's
Yes.
very hard to do though, but in essence, it would just be lean meats, fruits, vegetables, that's it really. And low processed food. Sugar is the big problem. People ask me, well, how much sugar should I consume? And really, you don't need any added sugar, but,
Correct.
reasonable limits. I think it's like 26 grams for a woman, maybe 40 grams for a man, but people are exceeding that. I mean, if I tell them to look at labels, they don't, but all of these things have got 10 grams of sugar. I mean, so yeah, sugar is bad. Processed food is bad.
Yeah.
But yeah, so that's good. You mentioned, I think just we're going to cover a few different
Great.
topics. So what are the supplements that you like? I'm going to run through mine. Vitamin D. You like that one?
Can we have an argument about vitamin D? Even though
Okay, yeah. Yeah.
I'm not a big vitamin D person in my practice. If someone is deficient, I want them not deficient. And
Yeah.
so I generally get my patients to 40 and then call it a day. I would
Okay.
rather have them be going outside. And the reason why is that I have never seen someone optimize their vitamin D and then take a step forward. So optimize being there's this argument that you should get from 80 to 100, and I've never clinically seen that make a difference. And when you take a step back and look at the medical literature, there's often vitamin D helps with this, doesn't help with this. It's kind of unimpressive when you look at the clinical result from the literature perspective. And so in my world, because I feel like there are things like the lifestyle and the gut that need the focus, I almost never talk about vitamin D because I want to be hammering home, what are you eating? Do you have sleep apnea? Are we missing iron deficiency? What's your gut like? What toxins are you being exposed to? Because it is my experience that those are the things that move the needle, not the optimization of the vitamin D. So when I give vitamin D, I like it to have K2 in it, but it's not an integral part of my practice.
Okay. All I would say is that most people in the United States are vitamin D deficient, about 70%. I mean, I like your idea of measuring it first. I mean, that makes a lot of sense, but there may be, I mean, you say you don't notice a difference clinically, but there may be some protective effects. So I've done a podcast on that. You can look at it and maybe tell me what you think.
The
Taurine. Taurine. The thing about taurine is that it declines with age, and there's some evidence that replacing taurine might be beneficial. What do you think of that?
and specifically taurine rather than other amino acids. I think
Yeah.
leucine is helpful from a muscle anabolic standpoint.
Oh, yeah. Yeah.
And so I will offer patients added leucine when they are really doing big time resistance training, but I have to admit I don't know anything specific about taurine.
Okay. Creatine. A lot of
Love
people
it.
like that. Yeah.
Love it.
Curcumin or turmeric.
So this is a neat one because in my practice, I see a lot of mast cell activation syndrome and turmeric, we'll say so curcumin, right? The active compound in the herb turmeric is an anti-inflammatory phytochemical that also has mast cell stabilizing properties in addition to analgesic properties in arthritis. So it's just one of those things that fills a certain niche in my practice. If someone has MCAS and musculoskeletal brain pain, it's a no-brainer to have the curcumin in, and that's where I like it the most.
Okay. And finally, magnesium.
This is one that I think is missed. It's really easy sometimes. Actually, you know what? It's not missed. Everybody comes in on magnesium. I usually don't need to give it to people
Okay.
because they're already on it and they're already kind of swimming in buckets of magnesium. But I do like it. I took 2 capsules last night myself,
Helps you sleep.
magnesium
Yeah.
glycinate.
Yeah. So those are my favorites. And I have to say that, a lot of people don't believe in supplements full stop. They don't like that there's not enough scientific evidence to their liking. So, and there are literally hundreds of books, hundreds of opinions about what are good supplements, and it's a huge industry. And there's a lot of it's speculation and wild claims. But while we're on the subject, have you got any favorite supplements that I haven't mentioned so far?
So probiotics are big for me because I deal with, I guess I would have to say the one that I made because I'm very quite biased there, but I treat a lot of patients with mold toxicity, and I know mold illness is something we'll talk about. One of the cornerstone treatments I was taught by my mentor to help reduce the toxic burden are binders. These are things like charcoal, clay, chlorella, and it turns out certain species of probiotics. And it, prior to there are a few combination binders, right? So I was taught kind of give a bottle of charcoal and a bottle of chlorella and a bottle of clay, and you can see real quickly that it's just a nightmare when people are on, they've got 15 different bottles of things coming at them. So I wanted an all-in-one formula, and it's
Mhm.
called ProBind Select, and you can get it from mossnutrition.com if you're a practitioner. Moss Nutrition is a really ethical company that I have a relationship with from for 10 years, and they really care about education and getting supplements in the right way to the right people. So I formulated it with moss, and I'm really proud because it's novel in that it includes the probiotics that bind toxins in addition to just the charcoal, clay, and chlorella, and it avoids a lot of the ingredients that people react to. So if you look in the literature, zeolite, silica, pectins, these are fairly common in other combination binders, but they either cause a lot of reactivity to patients, or number two, just have no medical evidence supporting their use. Whereas charcoal, clay, and chlorella do. And so when I formulated this, I wanted to really focus on the ingredients that I felt comfortable and confident in. So that would be
Yeah.
the other thing that's a mainstay in my toxic patients.
All right. Going to swing back to the lifestyle. So I think what's important in lifestyle at the moment is obviously nutrition, exercise, stress, sleep, and social connection. So
Yeah.
I've mentioned what I think about nutrition. Avoid, well, lean meats, fresh vegetables and fruit, and low processed food, and don't eat too much. What are the other elements that I've missed, in your opinion?
Well, it's hard to argue with that list. One thing is that I'll just quibble a little bit with the carbohydrate because I think the carbohydrate, or I'm sorry, the fat intake,
Right.
because I think that there are certain patients who can absolutely tolerate high meat, high saturated fat diets, and particularly when they're overweight, insulin resistant, diabetic. Leaning into the high fat diets is something that I find helpful metabolically. Not for everybody, but that would be the only quibble I would have with the list you gave, which I think is excellent.
And let's talk about exercise. Again, there are just hundreds of books, hundreds of opinions, what exercises to do. Now, it's interesting that you're into functional medicine and there is a push towards functional exercises because if you look at the Blue Zone Project, these centenarians, they
Mhm.
didn't go down to the gym. They're keeping themselves active. They go down to the shops, they sit on the floor, they get off the floor, they don't drive unnecessarily. They don't go into elevators. So, I think the first thing is to stop being sedentary.
Yeah, I agree.
Said that the average American is sedentary for 7 to 8 hours. And we have all these labor saving devices, right? Elevators. Well, I'm from England originally, and you can walk down to the shops and buy stuff. Whereas in America, you get in your car,
Drive.
drive all the way as
Yeah.
close to the entrance as you can, and we don't get a lot of activity. So
Right.
yeah, so I'll skip that because I would just say keep it basic. Keep a lot of my patients, I don't hammer them too much about exercise. Be as active as you can. Get them doing more than they're
Yeah.
currently doing. Stress. What are your opinions about stress? You must really look at that, at least look at it and give some basic advice.
My patients have really, they come in and they've done meditation, they've done adrenal adaptogens, they've tried to rearrange their life. And I would just emphasize stress does not cause disease. And I think it's too easy for us to blame symptoms on I'm just stressed. And so I would say stress can be gasoline on coals, but the coals are still there to flame up. And so I want people to be a little kinder to themselves about this because I see people coming in and they're just beating themselves up. I think it's from stress. I think it's from stress. And in reality, the stress may have pushed them down the path, but they've got some basic physical issues that need to be corrected. And so people just need to be kinder to themselves and do the best they can. Yes, there are tools that help. Usually it's getting them to actually sleep. Nor, if you want
Yeah.
to do one thing to help the overloaded, anxious, stressed out stress physiology is actually sleep. So sometimes I'll spend a lot of time on sleep, and it's I'm secretly working on the gut and the stress axis at the same
Yeah,
time.
sleep. So it's been shown that, about, I think, like 7 to 9 hours of sleep is really required for a lot of different things. But Americans don't get that amount. In fact, we're the only animal that limits the amount of sleep that we have.
Right.
And that has detrimental effects as
Sure
well.
does.
In fact, I was just going to say, I'm interviewing somebody this week, Steven Sideroff, and he's written this book, The 9 Pillars of Resilience, the proven path to master stress, slow aging, and increased vitality. So hopefully that will be up. All right, then.
I'll leave
So
sleep to the
yeah, I think we've done. Oh, the last thing that's been shown is social connection. Big,
yes.
big, big focus on
Hmm.
that. Social connections, helping with longevity, loneliness, very
Yeah.
detrimental. Anything to add there?
I would highlight, I was talking to James Maskell at a conference this weekend, and he's done some really amazing work, I think, highlighting this problem. He has a couple books on the topic that are quite good for anyone who's not aware of his work. James Maskell,
Okay.
Maskell.
Okay.
But
So
he's
we're going to put,
absolutely right.
yeah,
Yeah,
that's right. All right, then. So should we go on to toxic mold syndrome?
sure.
Okay. So toxic mold syndrome, it's also called chronic inflammatory response syndrome. And I must say, I didn't really know much about it until I did a little reading before this interview. So, yeah,
Yeah.
tell us a bit about that. I mean, it sounds like you're having a lot of success focusing on this and making patients better.
Well, maybe it'll help your listeners to understand how I got into this because I never thought that this would be something I do. But at the end of my residency, I was so devastated when the conventional training I was taught didn't help patients get better. And so I was like, I'm either a crappy doctor because I'm doing all the guidelines and I'm listening and I'm being there, I'm going above and beyond. I'm either a crap doctor or what I was taught was not accurate. And
Right.
so thankfully, it turned out that the things I was taught was really incomplete. And so that jumped me into functional medicine, and I started doing a lot of the lifestyle work that you were obviously so adept at highlighting, and people got better. And then there were some who didn't get better. And then I tried a bunch of things, all the lectures that people talk about, and I really came in on the gut being the next most important piece, right? And then so I do
Mhm.
the lifestyle, I do the gut, and then I got another whole cohort of patients better. But still, there were a few patients that had these weird, odd symptoms. They weren't responding to any of the other therapies or drugs or herbs or lifestyle that I had given them. And when I just started really asking, they were all living in moldy, water damaged homes.
Mm,
So I live in New Orleans, right? And so
right.
we are below sea level. We're a swampy, humid mess, and we get hurricaned every couple of years. But this is not a New Orleans problem. This is a worldwide problem. I have patients in the UK, right, who are living in damp, sick
Yeah.
buildings. I have
Yeah.
patients across the world now dealing with this, including here in New Orleans and the Gulf South. So once I figured out that mold was a trigger, the question was, how do I get them better, and can I get them better, and what do we do about it? And so that led to kind of the next phase in my evolution of my practice. And maybe I can start off by just giving you the broad overview of mold illness as I see it, because I don't agree with this chronic inflammatory response syndrome as being a definition for mold illness. And I can tell you
Okay.
why, but from my perspective, mold can cause illness from different mechanisms. And so, very clearly, what we're taught in medical school, and probably what you were taught, Noor, right, is
Mhm.
that mold is an allergen. It's a strongly antigenic. It produces spores and fragments of mold that are highly allergenic and can obviously cause respiratory problems, sinus infections. And that's true, right? It's undoubtedly true. But I'm seeing patients now who I have taken. One of my first patients was a gentleman working on air conditioners for 20 years. He was
Mhm.
having daily seizures, right? He's crawling up in moldy ACs and
Mhm.
taking out ductwork, and he's got mold exposure for years and years and years. He's having daily seizures and tremors and depression, right? tremors and seizures are not allergy symptoms, right? And I'd see more. I'd see odd pain syndrome. I'd see chronic fatigue. I'd see odd peripheral neuropathies, things that weren't explained by other illnesses. And more often than not, those were explained by mold because when I got them out of the moldy environment and I treated the mold, probiotics, binders, and sometimes antifungal medications,
Mhm.
those symptoms went away. So for me, you have to consider the fact that mold can cause allergies and toxicity. And this is predominantly, we think, an immunological effect from the mycotoxins, the toxins that mold produce defensively that we get exposed to. Those can also overlap. So if you have a Venn diagram of mold toxicity, mold allergy, there are pieces in the middle where they both can overlap. And so some patients you really just have to focus on the allergy. Sometimes it's the toxicity, and often it's both.
Right.
Does that make sense?
Yeah. All right. So let's say I'm in my clinic tomorrow and I'm thinking, I wonder if this is mold toxicity. I mean, how do I make the diagnosis? You've talked about the some of the treatments, but how do I
Right.
make the diagnosis of
So
possible?
let me give you the official criteria as made up by Dr. Mather.
All right.
Okay. If they can
Yeah.
make up the Sears criteria, I can make this up. Okay.
Right.
So for me, there's a symptom constellation. And number one, you have to have chronic fatigue. If you don't have chronic fatigue, I'm not buying it. I'm not buying that it's a mold toxicity. You
Hmm.
also have to have persistent, either neurologic, psychiatric, or neurocognitive deficits, not explained by another process, right? Though that's the piece, right? So intractable depression plus chronic fatigue,
Right.
seizure disorder plus chronic fatigue, right? New onset schizophrenia plus chronic fatigue. That's kind of number one, that general pattern. Number two is the disease. It can't be explained by something else, right?
Right.
I think that that's really important for us to do. Number three, symptoms have to have had begun or worsen upon exposure to a water damaged building. If you don't have that chronology, again, I'm not buying it. We're all
Right.
exposed to molds. There's probably a little bit of mold in this room here, right?
Yeah. Hmm.
Different people have different susceptibilities, but if you don't move into a place and 6 months later you have new onset inflammatory bowel disease, right? Like I see that often. I see mold exposure, new teacher, new classroom, Hashimoto's, and chronic fatigue, right? You need to have that exposure to make it. And then number four, for me as a medical doctor, because people are not familiar with this, I need to have biochemical evidence of mold, right? So for me, that's either serum antibodies to the molds that can cause that build mycotoxins. It can be urinary mycotoxins, and there are a few other tests that I use, but those are the two that I use most commonly in my practice. So number one, symptom constellation. Number two, not explained by another illness. Number three, associated with exposure. And four, biochemical evidence of mold.
Okay. So if I'm sending a patient off to the lab, what lab test do I ask for? Is it serum
So I get
or
serum.
antibodies or?
So I used Quest because I see
Yeah.
people around and that's the most easily available. I get IgG antibodies to Aspergillus, Penicillium, and Stachybotrys.
Right.
Those are three separate Quest test codes. And then there's a mold IgE panel, which
Right.
includes those and Mucor and maybe one or two others. So it's IgG and IgE. And I've been doing those antibodies now for about a year. And my observation after seeing maybe 75 patients with those antibodies is that you can obviously have IgG and IgE, but often the pattern will tip you off if this is predominantly allergy or if this is predominantly toxicity. In general, I'm finding more patients with those neurologic chronic fatigue, autoimmune conditions are having the IgGs being high, and then those with the mast cell histamine allergy issues are IgE. And so for that reason, I'm finding the test pretty helpful, and it can be covered by insurance. It's just a single blood draw and quite easy for people to get.
No, that's excellent. I didn't know that. So we might be missing a lot of these cases and missing the opportunity to help them. So
Whenever
no,
I have a patient and it's been 6 months and they're in and they're not better, they're not clearly dramatically better. I'm missing something. We are missing. They're either not doing what I'm asking them to, and I have a private cash pay practice, right? So they pay me and they're incentivized
Yeah.
to do what I ask them to. So my
Right.
patients do the stuff, right? But if they're doing the stuff and they're not better by 6 months, then gloves are off. Is this mold? And 60, 70% of the time it's mold in
Oh,
those
wow.
patients who are not improving. So it's just, fundamentals, gut, mold. There are other toxic things that are absolutely problems, right?
Yeah.
But just to shortcut the heuristic, that's what I like to focus on.
Yes, and I know you work with a psychiatrist, Dr. Podesta, and we've done a couple of
Yeah.
podcasts. And what I always say that the psychological component's very important. Most of these patients become depressed and anxious. I
Yes.
mean, who wouldn't be? If you're ill and you're not able to get back on your feet to where you want, you would develop depression and anxiety, and then they make each other worse, right? So you
Hmm.
get depressed, and that makes your symptoms worse, and then your depression gets worse. So I can imagine how that would be beneficial. So,
And there's
um,
actually a related concept here that's unique, not unique to mold illness, but very common, and that is limbic dysregulation.
yeah.
And is that something that you work on with patients?
Well, only that I know is that, the limbic system's your emotional control system, if you like. So, but yeah, I mean, any emotional disturbance that I see, we do a screen where we look for stress, anxiety, and depression. But yeah, a lot of medicine, it boils down to a brain dysfunction.
Yeah.
Um,
May I give you my perspective on limbic,
oh,
just in case it
yeah,
helps
yeah.
your listeners? Because it's absolutely the seat of emotion, as you say, but in my mind, it goes deeper than that. The limbic system is the home of the kind of unconscious protective part of your brain that's
Hmm.
scanning the environment, saying, "Am I safe?"
Oh, yeah.
And when patients innately don't feel safe, their limbic system fires off. And when the limbic system fires off, it then starts activating the immune system, particularly mast cells and immune defense cells, to set up a
Mhm.
chronic inflammatory response. And so the end product that we can see on labs is that mast cell and inflammatory burden, but sometimes it's all from that limbic headquarters on high alert, right?
Yeah.
It's red alert.
Mhm.
And the things that commonly trigger this limbic dysfunction, mold toxins are uniquely and horribly damaging. It sends a very strong signal. You're being poisoned. Your environment is not safe, and that limbic system just clicks on and stays on. And for a lot of patients, you have to really work on that before you can calm down the inflammation. The other is trauma. So, childhood trauma,
Mhm.
rape, abuse, neglect, poisonous relationships.
Yeah.
People don't feel safe. And so, when they come in with that background, you'll find the patients that end up getting the clinical manifestations of mold toxicity often have a predisposition for their limbic system to become disordered from that trauma, right? It's one of the
Mhm.
things that sets off the whole cascade. So there are a couple programs online that are really game-changingly helpful for patients who get stuck in this really hard place. It's these are the people who react to everything. They'll tell you, I can't take that. I drink a glass of water and I get symptoms. I take one single capsule of this and I have a reaction. I can't take any medications. They have limbic dysfunction and mast cell, and it's like the red flag goes off, like this patient's probably living in mold. And it's pretty common. Once it's like one of those things that like once you see it, you can't unsee it, right?
Yeah.
And like the logo on FedEx, you're like, there's an arrow in the FedEx logo. Like, ah.
Yeah, 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 yeah. That's right. You're very right about this thing of people not feeling safe. It's come up in other discussions. One for sleep, because one thing about sleep is you get in your bed, you want to feel safe
Yeah.
and have peace of mind. And you're right, people don't feel safe and they don't have peace of mind. It's especially these days. It seems very unstable. We don't know about the future. There's violence, there's, financial insecurity. So yeah, people don't feel safe and secure, and if mold is making that worse, that they're
Yeah.
in a lot of trouble. Okay, well, it's coming up to the top of the hour. Is there anything else you would like to add? I think we're going to get you back and talk about some of these other things because these things are not well known. I think they're very important. I think it's a big gap in what we're doing in medicine. So I'm very grateful for you to come on and really open our eyes to this.
Thank you. It's a pleasure to be here and happy to be back anytime.
All right, thank you. We'll have a
All
good
right.
evening.